Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Welcome to the show. We meet here every Saturday at 10:30 a.m. And if you're watching us live on YouTube or Facebook, glad to have you on board. You can learn more about the show by visiting us at UroPatient.com, the best place to go to learn more about our show. Also, you can find all of our past episodes. Remember, this was created for you, the patient out there. I also created all these helpful handouts. Every time I have an episode, I've got a handout to go along with those episodes. You'll find them helpful. Check them out at any time. They're there for you guys. So let's get started on our next episode. Today, I'm going to discuss the causes of erectile dysfunction. When a man becomes sexually aroused, his body undergoes a physiological change that leads to an erection. This process is controlled by the nervous system and involves a combination of physical and psychological factors. So it's basically a combination of the nerves and the vascular system. We call it a neurovascular event. That leads for a lot of problems because if something breaks down in either one of those, then you don't get an erection. I've often heard it said sometimes it's more of a miracle that we get such reliable erections for men. Sexual arousal often begins with thoughts, images, or sensations that trigger signals in the brain. These signals activate the release of chemicals such as dopamine that play a key role in arousal. The brain then sends signals down through the nervous system to the arteries in the penis. These signals cause the arteries to relax and widen, allowing more blood to flow into the penis while restricting the outflow. As blood flows into the penis, the erectile tissues inside, called the corpora cavernosa, fills with blood and expands. Now, those are these little, like it's almost like a sponge, and those little cells fill up with blood. So this increased blood flow fills up those little spots in the corporal cavernosum and causes that stretching effect and that firmness, and that's what causes an erection to lock in. It's also requires that there's less blood flowing out. So as more blood flows in, less blood flows out, you trap an erection. Pretty simple, but very difficult thing to accomplish, a neurovascular event. Now, sometimes there can be some problems getting hard, as we mentioned, and we're going to talk about what those are. So hormones play a key role in this whole process. Testosterone, the male hormone, is particularly important for maintaining sexual drive. Not completely necessary in order to have an erection, though, but it is what makes men want to have sex, so it does help contribute to the erections. However, there's other chemicals and messengers involved in this complex interplay called sexual function. Now, male belly fat, as you may not know, especially when you have too much of it, can contribute to the increase of estrogen. So it's like almost its own little estrogen factory. Within the fat cells, there's an enzyme called aromatase. You don't have to memorize all these names, but I'm just like to throw them out there so you know. This enzyme converts testosterone, the male sex hormone, into estrogen, the female sex hormone. Now, everything works like a balance. So there's testosterone and some estrogen, but as you start to increase the estrogen levels and testosterone level will start to decrease. This can cause a variety of things to go wrong, including decreased sex drive and sexual dysfunction. Now, smoking is also a big contributor to issues with erections. Sometimes just stopping smoking can improve your erections dramatically. It contributes to the buildup of plaque inside the arteries and causes narrowing. Remember, we've got to send blood down to the penis. If you go and start obstructing those little arteries, then you're going to have problems. Smoking can damage the nerves that play a role in the erectile process. Neurovascular, remember. Smoking can also disrupt the hormonal balance in the body. So that combination can just cause all sorts of havoc. So on the side of every pack of cigarettes is this warning put out by the Surgeon General. Smoking may cause lung disease, heart disease, emphysema, and may complicate pregnancy. However, what it should really say is, and may cause impotence. That would stop people from smoking, I think. Alcohol is another factor that can contribute to issues because alcohol is a depressant. It can interfere with the nervous system's ability to transmit signals necessary for arousal and sexual function. Also, alcohol can impair blood flow to the penis by dilating other blood vessels, which then can further contribute to erectile difficulties. Long term alcohol abuse can also lead to chronic health conditions such as liver disease, nerve damage, hormonal imbalance, cardiovascular issues, all which can negatively impact erectile function. So, got to give up the cigarettes. Be sure you cut down on this alcohol. Another problem that can sometimes affect it is we said it's a vascular event where blood flows into the penis, but it's got to be trapped. If it's not trapped properly, that can cause a problem. So imagine if you're blowing up a balloon. Now imagine if you're blowing up that balloon and it's got a hole in it. Well, what would happen is that's what happens when we have an issue called venous leak syndrome. It's also known as a veno-occlusive dysfunction. It's a condition characterized by impaired ability of the veins in the penis to retain blood, leading to difficulties in achieving and maintaining erection. We'll see a lot of patients come in complaining, it gets hard but won't stay hard. As soon as I try to insert it, it goes soft. And it may be that you have this problem. Things can be done to improve that, but this is another issue with why we can have trouble with erections. And the brain has a lot to do with our whole system. Emotions, psychological state can significantly influence erectile function. Factors such as high stress, anxiety, depression, relationship issues can interfere with the brain's ability to send the necessary signals for arousal and erection. I had a patient come into the office, and it was classic for this problem. He said that when he goes on vacation, his erections are perfect. But when he's working, he has trouble with his erections when he's, back at the day-to-day stress. I asked him, I says, how much do you work in a week? He says, well, about a 60-hour work week. He says, high stress job. I said, oh yeah, high stress job. So, stress can play a part. The key thing was on vacation, when he gets away from all this stress, he's normal. So he was missing it, but I wasn't. And another thing that happens, if a man fails to get an erection, sometimes the worry can cause performance anxiety. It actually has a technical term for it. So sometimes your brain is just thinking about, ooh, I had trouble that last time. Will I have trouble again? And you will, because if psychologically you're worried so much about your erection, it may not occur. And sometimes we actually treat that with a medication we can give you. And once your confidence comes back, you no longer need the medicine. So keep that in mind. Don't worry about it. Sometimes it doesn't always work. It doesn't mean it won't ever work again. And also, I mentioned there's some chemicals and things that are involved in this. And I kind of like to reckon this whole thing to what I call like the teeter-totter or seesaw effect. So normally during sexual arousal, there's a release of something called nitric oxide, one of those other chemicals in the penis that leads to the production of something called cyclic GMP. You don't have to worry about what that means, but the bottom line is that's what's involved with causing the artery in the penis to expand to allow increased blood flow. It relaxes smooth muscles and blood vessels in the penis, and that's what causes the blood to flow in. And it's kind of on a balance. So as we start producing more cyclic GMP, then we're going to start to cause the erection. The balance flips. Now, the reason a man doesn't walk around with a constant erection is because of a chemical called PDE5 or phosphodiesterase. That's a mouthful, 5. It's an enzyme that breaks down the cyclic GMP. So it makes it go away, leading to the cessation of the erection. So the balance changes, as we kind of see here in my little slide graph. As we start to have the PDE5 can go ahead and start breaking it down, it'll start to switch and the erections go away. Theory is sometimes you may have too much PDE5 to overcome how much cyclic GMP is made so that it doesn't cause that flip to cause the erection. And it was discovered by accident by a pill called Viagra. Viagra was a drug used to treat high blood pressure. And these patients were all of a sudden having, some control of their blood pressure, but walking around with erections that they hadn't had in a while. And they said, maybe there's something to it. Well, it's considered a PD5 inhibitor, and such things as Viagra, Cialis, Levitra all work by inhibiting PDE5 so that there's more cyclic GMP able to cause the erection than PDE5. So inhibitor gets rid of. and that facilitates and sustains erections. That's why that little blue pill works. We'll talk about that more in our next episode, how these medicines exactly work, but just to keep that in mind. By blocking the action of PDE5 with these medications, it can amplify the natural erectile response to sexual stimulation. Now, it doesn't mean it causes an erection. Keep that in mind. This means that men with ED who take a PDE5 inhibitor may find it easier to achieve and maintain an erection with sexual activity. Big step that we don't always, that's probably not stressed enough. Patients take the pill and just look down and wait for something to happen. It doesn't. You need sexual activity. It's important to note that these medications do not directly cause an erection, but rather enhance the body's natural ability to respond to sexual stimulation. Another cause of erectile problems, aging. Most of the stuff we talked about occurs as we get older. So age-related health conditions, especially things like diabetes and hypertension, heart disease, and certain lifestyle things that come up like smoking, obesity, can all exacerbate erectile problems. And elevated blood sugar is one of those biggies associated with diabetes. It can damage blood vessels and nerve vessels. So two things that it can cause. The nerves that go to, if you've heard of diabetics having problems with numbness in their feet and stuff, those nerves are much bigger than the ones that go to the penis. And often, sometimes the first sign of some of the diabetic damage to nerves can be problems with the erections, problem with sensation, because those nerves can get damaged by the high sugar levels. So next week, we're going to start taking our dive into all the treatments for erections. And we've got 4 of them that are out there. And that's why I got these 4 little pictures. We talked a little bit about the pills as being one of them, but we have an injection that we can go and teach patients how to give themselves a cause an erection. We have an over-the-counter device called a vacuum erection device that we're going to talk about. And there is the surgical procedure that can be done, several different types that can be done to correct this. So I hope you enjoyed this episode. We'll see everybody next week on UroPatient.com.